Hello, my name is Dr. Cruz,
And I'm Dr. Gray.
and we are here to present on our poster, which is titled the ACGME OR Supplemental Survey. Some background on this is in 2015 to 2020, the ACGME ended up merging and creating the osteopathic recognition milestones. And in reviewing a recent publication, it showed that there were 5 major barriers to implementing these milestones. And it also showed that residency programs were plateauing in trying to seek osteopathic recognition. And if you look to your right in the middle of the poster, this is an example from the ACGME osteopathic recognition milestones. We ended up reviewing these and found that there was some gaps, as well as some potential solutions to understanding these milestones. Our first steps would be to gather some more information about the supplemental guide as it pertains to the people using it, which would be the residency programs, the coordinators, and their directors. Our aim statement would be to improve the understanding of this guide, as well as increase the implementation of it. So our first task was to conduct a survey to further understand our audience and their understanding of the osteopathic recognition milestones. We ended up doing this through a survey by SurveyMonkey, and that was 9 questions. 8 of them were yes or no questions, and one of them was to understand their role that they take in a program. And we ended up getting 37 responses, which are in the results section, and I will pass this to Dr. Gray.
So our results section is a direct reflection of the understanding of the table above, patient care, as well as the rest of the OR milestones. So our questions were, are you familiar with the osteopathic recognition supplemental milestones for your residency program? It was approximately 70 to 30 percent of program directors, faculty that understood and were familiar with the osteopathic recognition supplemental milestones, where there was a 30% deficit. Similarly, do you know where to find the OR supplemental milestones? This is very concerning that 30% of the people that are evaluating our residents are unfamiliar with where to find the supplemental milestones. We asked the question, do you feel comfortable implementing supplemental milestones? 81% said yes, whereas 19% said no. And then in your practice, do you routinely use osteopathic principles to assess the whole patient? It was a resounding yes. 100% of our faculty in OR programs do routinely use osteopathic principles to assess the whole patient. So in completing the survey, our first step in our process to improve, this is our first step in our process to improve understanding and implementation of OR supplemental guide. Our survey, 30% did not know where to find it and felt like they understood them. We do acknowledge that people who take the survey may not be program directors or directors of osteopathic education. However, it taught us that we are heading in the right direction. Our survey did not provide initial improvement. However, our next steps have the possibility to show benefit after implementation. So our next steps is to provide revised examples of the OR supplemental and seek feedback. We would then provide a survey to see if the revised examples have improved overall understanding and implementation of the OR milestones. If there is local success, there's opportunity for this impact at the state and national levels. Here is our example of the patient care one, reflecting back on the OR milestones that you see in the middle of the poster. We went ahead and added a clinic, surgical, and other while following the same format. We felt like we were able to improve the flow, improve understanding from the novice at level 1 to a level 5, which would be an expert level. By doing this and keeping an overall theme of upper respiratory infection for this particular example, we feel like our programs would have better understanding for implementation. You can see our references here and that this poster is IRB exempt. We thank you for your time.